welcome to this session, which is talking more about the research side of Africa, empowering African research. First, thanks to the government of Japan for initiating the Noguchi Prize. But I think one thing that's been important, that has not just been an award ceremony, which is a wonderful occasion, and then forgotten for 5 years until the next event happens. But the organizers and the group looking after that have tried to keep the initiative going through having meetings like this. And so thank you to everybody as well who's organized this meeting, to the Kenyan people who've contributed, and also to our Japanese colleagues, and particularly to Dr. Weri. I'm going to talk to her afterwards. If I go out into town looking around, I'm going to ask for a little personal security from one of her speakers. So let's first introduce the speakers. That Dr. Iye couldn't come for this. I think, Bernard, are you representing him? Or you're here in your own right, because you're not on my program. Anyhow, that's fine. So Dr. Guta will talk to us. We have Professor Quadwell, or Kojo to his friends, Koram, who is director of the Noguchi Institute, so it's very appropriate in Accra for this occasion. Professor Suleiman Mboub, who's director of microbiology and virology at the Hospital Dantec in Dakar. So we have Francophone representative, and Dr. Kiru from Kenya. So I think Dr. Kiru was due to start, but just a few words from me before we get going. I mean, as Professor Kurokawa said at the beginning of the talk, I've been working actually for 50 years now, not 40 years, and a lot has changed in that time. And I'll just give you one example of how things have improved. In 1997, we had the first meeting of the malaria multilateral initiative for malaria meeting in Dakar in Senegal, and Dr. Varmus, who was then the director of NIH, came and stayed for a week in Africa for that meeting, and that was perhaps the renaissance of really research in Africa on malaria, which had been forgotten for perhaps 20 years. And I was involved in organizing that meeting. We had difficulty in finding 50 African researchers who were working on malaria to come to that meeting. Dakar has just won the competition to host the meeting. I think it will probably be in the beginning of 2018, end of 2017, but it'll be the 20th anniversary. I expect we will have 2,000 African researchers working on malaria at that meeting. So there has been progress, but we need more. And as I think anybody involved in global health realizes, the whole thing's got much more complicated than it was 20 years ago. It's not just distributing bed nets or ACTs or antiretrovirals. The whole thing has become much more heterogeneous, more complicated. We need different things happening in different parts of the country, and that needs really good scientists. And just because numbers are going down, I don't think that means that we should be reducing the amount of research that's being done. So the task of our speakers today is to talk about how we're going to empower malaria how we're going to empower research in Africa, and I hope we'll have time afterwards for a few discussions. So I think our first speaker is Dr. Kiru, who is from the KEMRI here, with its very strong links with Japan and all the support they've had, and you're going to tell us a little bit about links between KEMRI and Japan, I think, and research of your institute. So, Dr. Kiru.
So, good morning. I hope you still, no, good afternoon. I'm very, very happy to be here representing KEMRI. And as the first speaker, Professor Were, actually introduced us, we actually introduced ourselves as a premier research institute in Africa. And this is not achieved just through our own initiative, but because we are supported by a lot of people. And actually, many of you may not know that Japan has really supported KEMRI right from the inception in 1979. And Japan has continued to be there. JICA has been a very key player in KEMRI, especially in the early 80s and 90s. And currently, we also have other Japanese arms, including the Nagasaki University. So when I was told to come to this meeting, I was told to talk about some of the challenges we face and how the collaborators actually come in to close some of those gaps. I can just summarize these challenges just in several words. First of all, it's funding. Every researcher talks about problem of funding. And in terms of funding, it's local and also global, simply because as a young researcher or a mid-level researcher, there's a lot of competition from established groups. But let me recognize the contribution of the government of Kenya. Recently, we were able to access quite a generous research kit, and this is available to Cambridge researchers, and we have actually been able to do a lot. This is the first year that we are working on this, and this is a very big advantage. Then, of course, we have a lot of collaborators, the Walter Reed Project, the CDC, the Wellcome Trust, and of course the Japanese institutions. In terms of infrastructure, we are still squeezed. Many of you know when Cambridge was introduced in 1979, we have of course outgrown that, the space that we have and also the structures. And in terms of this space, our labs are still not very, they're not exactly how we want them to be, but I think there's a lot of help that we are getting nowadays. And we believe that this will help, especially with our collaborators, even to help us achieve accreditation in all our major labs. I would recognize that the Japanese government, the JICA or New Team project, has helped us actually acquire a P3 lab, so we are able to process highly pathogenic bacteria that previously we could, or pathogens that we could have actually sent abroad previously. The Japanese also support our production unit, and there we are able to make kits for HIV, hepatitis, and so on. And these kits are even now being sold in the region. The Wellcome Trust, the CDC, have helped us to make very, very good, what I would call ultra lab facilities in Cambridge. But there's one thing we have always wished for. When we do human medicine research, we normally rely on other hospitals. So this being a wish list, if the collaborators plus the government of Kenya at one time could help us possibly make our own referral and teaching hospital, that could really be important because it could actually link research to treatment. Human capacity, we still need the development of the minimum. So finally, is the issue of mentorship and access, expanding networks. We want to keep this growing because this will help us bridge the research gaps and also other gaps that we have. Thank you.
I think you want some slides. Yes, so Professor Amboop has some slides. I mean, many of you will know he's a very distinguished virologist for his work on HIV too, but I think he's now got a new challenge in setting up a whole medical research complex, a new university outside Dhaka. I think, how do you pronounce it, Suleiman? Diamanido, is that right? your new venture, yeah. Okay.
Show it. I would like to thank the organizer for inviting me and give you some opportunity on the gaps which the medical research are facing. Next slide, please. When you do analyze the situation in Africa, you will have many points, but one of them is the capacity for really most of the nation to correctly support research. And most of the successes are really dependent on the tenacity of some individual scientists. Next slide. The training of manpower is conducted by universities in sub-African Africa, but also Western nations, where sometimes you have the best and brightest from African are trained, but is this training really appropriate in developing country, and mainly based on the infrastructure which is not available at home, and as a consequences, most of them do not return to their country because of inability to do the research they are used to do, which is one of the main causes of the brain drain. Next slide, please. Those are the main really challenges in Africa. There are three-fold. One is the external environment. The second one is the infrastructure and work conditions. And the other one is the career. Concerning external environment, we don't have really enough research culture. They are not the research demand. The research is not really supported by public. The bureaucracy and political instability also. Regarding infrastructure, everybody knows that exceptionally there are poor infrastructure and lab equipment, but institutional instability, institutional research budget limited, as previously said, and lack in information and data resources. And for the career, most researchers are in intellectual isolation. They have limited career perspective, insignificant remuneration, insufficient training, and limited personnel support. Next slide, please. So those contracts that conduct research in the developed countries are sometimes an absence of well-defined national research policy, insufficient coordination among researchers, isolation of researchers, shortage of multidisciplinary research, lack of information, and also inadequate research budget. Next slide, please. There is also some additional need. It's not only the research infrastructure, but all the other aspects surrounding it, like the administrative management. We are lacking expertise in trial management, communication system, data management, statistical analysis, training of staff, lab support. So it's not only the researchers, but the whole environment of research. Next slide. Okay, so it's good to face the issues, but what can we do? We need to maximize the country's qualified human resources and ensure their succession and create structure of research to valorize research activities. Next. So I think it's very important to create some center of excellence in different regions of Africa to promote the development of true and equal partnership between African institutions, provide sustainable effort, and generate useful findings to help against those challenges. Next slide. And this is the reason why we created a new institute, which we call IRSF, in English, Health Research, Epidemiological Surveillance and Training Institute. Next slide. The vision is to have a very high profile and internationally institution of excellence in the field of health research with expertise and state-of-art equipment, but also with positioning Africans and Senegal in particular among the greatest nation with researchers. Next slide. And you can see this is a combination of the main building where you have training centers. We have a conference center with 500 seats. We have also a clinical lab and also a clinical trial site. Also different lab, bacteriology, virology, immunology, and also the whole epidemiological management, IT department, and also international cooperation. Next slide. So what can we do really to sustain the research manpower is maintain research institutions and healthcare facilities, having programs of training of researchers, national research policy, and particularly which will encourage scientists to address needs of their particular country. Next slide. And define well-funded research policy, elaborate national training program, and also make research career being a satisfactory professional and also with a good remuneration. Thank you.
So can I ask you a perhaps slightly embarrassing question? I mean, it's a fantastic initiative. Who is paying for it?
The government of Senegal is giving the land, and Gilead has provided at least 2/3 of the support. We are just seeking for 1/3 of the support.
But there is a real commitment from the government of Senegal.
Oh yes, because they are giving the land.
Yeah.
I think they are really supporting the whole process.
Okay. Good. Okay. So let's turn now to another more established research institute, the Noguchi in Ghana, which is a very appropriate to hear about in our discussions today. So Dr. Koram is the director there. He's going to tell us. Thanks.
Thank you very much, and thank you to the organizers for getting us all here. And as has been mentioned, probably we are one group that have to be here because we are an institute built for and in memory of Dr. Hideyo Noguchi, and that's where we work. I have one other colleague sitting besides Bright who is here. And we are very grateful to the Japanese for the support, first for the vision actually to establish this institute, incidentally also in 1979, so I'm not sure. We've been around since then, but gone beyond yellow fever and the viral studies initially into tropical medicine and all the infectious diseases research. Currently, due to the changing patterns of disease, we are also taking on issues of non-communicable diseases as the lead research institute in the country. So when I was giving this talk, I was actually thinking how to approach it, and the way I have done is just have a few notes as to how probably our governments and also institutions can be supported to encourage first retaining those who are trained and also those who trained inside the country and those who are trained outside to be able to stay on and contribute towards solutions that we have to provide for the things. I'm all for training people outside because it gives them a different view, and also, but then we have to have structures to allow them to come in. As an aside, I was lucky in my early career to get trained with Prof. Brian Good in Gambia, and I was just telling the young groups that we met that looking back, a lot of things have changed, because at the time when I was working in my rural district in Boku, which was far away from medical school, and decided that I wanted a career in public health and epidemiology and research, there was practically very few places besides Gambia and other places that you could look up to. Fortunately, I was able to be accepted in Gambia and work with Brian and others. But I came back to a place which is established, or was established then, in Noguchi at the university. Currently, we've gone on from there, not just providing for locals, but we've actually have a postdoctoral training program, which I think is quite critical, because when you've had your PhD, I believe that is when you have the work is starting. But when you come back, you're thrown into a university academic position, you have 1,000 students to start teaching, and research simply disappears from the horizon or from the agenda. So we need to have organized postdoctoral training programs in all the places. For the young ones, come in a couple of years, 3 years, some may decide that, after all, this is not what I want to do, but at least it gives them the opportunity to weigh the things and also to learn what it takes to work in an African environment. There are a lot of points that I have on those issues, which I'll just go through at the moment, and we hopefully pick some of those issues up as we go along. One thing is to have the people, when they come back, is to actually let them get settled into a career position so they know there's some progression. If they do work hard, they are going to get somewhere along those lines. Fortunately for us in Noguchi, we are part of the university, so you get into the university. It has its own problems, but at least you know that you have a position in the university which you will have to work to keep that position. So there are questions we need to look at, whether you have to have the MRC units, where I was fortunate to work with all the support, and Cambly, which stands alone on its own, and that's what work we do. Then we have to look at the models and see, but above all, we always have to make sure that we do have the positions for them to come to. There's always been issues about money. My honorable minister is here and things, so they will tell you the university you can't employ more people and things. But I think we need to sit down and have a look at how we could have arrangements where, for example, a senior professor or something like that will have the opportunity to, on his or her grants, to bring 2 or 3 more people and pay them directly on that for probably up to another 3 or 4 years, whilst that person also works on grants and things. Because we need to do a lot more. I work in malaria. Now there's a huge case of, well, I've been working with some of the pathologists in Kolebu, and when I look at the data for cancers, for example, I get frightened. But then I don't have the leeway to say that I'm employing somebody to come and look at cancer. I have a lot to do with malaria, so okay, you want to do something on cancer. I don't have time today, but the problem that we have to solve. So we need to really have rules and things of how we're going to do this. I think one thing would be to have competitive local grants are made available to the research institutions. We just have to go ahead with this and probably just stop. The other thing I'll talk about is research support. And what I mean is really companies, or we need to encourage equipment maintenance companies. There was a talk about a request for having equipment in place and having all those fine things in. It's one thing having them, and sometimes I say it's even easy having them. You may get a donation. You get a donation, it works for 6 months, something breaks down. If it's beyond what you routinely can fix in the lab, you're in bad business. We had a very bad experience when I work in malaria. So children, you cannot bleed them a lot. So we decided to buy an equipment where you could work what you need 5 mils for, you could do on 0.5 ml of blood. So we got this fancy equipment. It came in, it worked for a while, about 3 months, something got spoiled. We called the company in France. Yes, it's under warranty. We have to come and fix it for you. The technician who is scheduled for Africa is dead. We haven't replaced him, so wait for us. We had to wait for 18 months. And that's work that we could not just have to. So something has to be done to have local companies, young people setting up to study these things and be able to support the research organizations. Otherwise, if you have somebody who's trained in Copenhagen, where he picks up a phone call and this is fixed in 24 hours, and you ask him to come and do his work, if he's been back for 2 months, he probably call his supervisor and says, do you have a position for me still? And you won't see him again. The other thing will be also how to have small startups to pick up the products that we come up with. And I like what has been happening in Camry. Noguchi, a few years ago when I joined, one of my colleagues who was actually trained here in ILDRI or something, the Research Institute for the vets, yes. He came back, he trained in trips, but when he came back, very little trips in Ghana, so he switched to Schisto and worked from first principles to have a product that you could actually use to test for people who have Schisto beyond just the microscopy. So you could carry this to every village. But when he finished, and this has to be developed, the monoclonal antibodies he had, unfortunately for us, was at a time when we had power cuts. So the freezers went off, no liquid nitrogen, everything collapsed. So this has been there. And in fact, he, in particular, when I have a look at it, is sort of taking his passion for, is diminished his passion for research. He's in there still, but he thinks, if nothing is going to come out of this, why should I continue? But so we need to have those things that will help people to see that this is moving on beyond just what I'm doing in the lab. One critical support area, which Mr. Minister, you are here, I think I'll have to, unfortunately, we have to meet at such places, is support for simple things like customs clearance. I have an equipment is usually not a problem, but if you have a reagent which has to be shipped on a cold chain to your lab, it gets to customs and you have 72 hours arguing with some customs officer why you should get this thing out, and he doesn't care whether he's sitting in his office and not in a freezer. By the time you take charge of it, $10,000 worth of your reagent is bought. And then you start scratching your head, what are you going to do? So we get these little things which it may appear simple, but I think it's very important that we do get the support to do those things we have to do. The other thing is training, which I mentioned earlier, not just the initial training, but also postdoctoral training, which we have to do to get people on to actual work. Fortunately for us, over the past 5, 6 years, we've had the help of the Gates Foundation to establish such a program for young African scientists. We are towards the end of it, but we hope that we'll be able to continue and actually continue that opportunity. I think at the last count, we've had positions for about 18 young Africans, all congregated at Noguchi. I think there are 2 from Kenya, others from Cameroon, Nigeria, Senegal. We have one from Senegal who is working with us. And we find this is very good. It's giving them the opportunity to meet at an early stage and also begin the networking that, I'm not going to talk much about funding because I think everybody will talk about funding when you're doing research. But the big thing is that I think we need the local companies and the local, our governments to take up the issue of funding, because when we don't have that, getting onto the stage to apply for an NIH grant is good. You get one, you get going for a while, but you have to remember it's for US and the whole world at large. So if you're starting off in some small corner in a university or a research institute in Africa, the chances are very, very minimal. The other thing is that the institutes need core funding. The big problem or the big lesson I learned over the past couple of years with the power cuts was that without core funding, it will be very difficult to maintain these places. Just keeping the power system running so that you don't lose your reagents and you don't lose your samples was a big challenge for us. I mean, it's been really something that we've put up through the university and probably will end on your table of the Ministry of Education. We really need core funding, which will allow us to run without some of these issues. So I think I'll end here for the questions. Thank you.
So I think that you bring up one very important issue there, and I think which your postdoctoral program is doing well, is that there have been these centers of excellence that a few have been established. And if you're going to go for your postdoctoral training, you can get stuck if you're training a lot of PhD students. You may be, I think that has happened in Kemri to Kalifi to some extent, if there isn't a program. And one solution to that is exchanging between the centers in Africa. And of course, that's what happens in a developing country. You may be working in one university, you do your first postdoc, you move on to somewhere else. And I think that's really been a very important initiative, that we can encourage more exchange at the postdoctoral level between universities. So I wanted to ask one question before we go on to Ben. The question about the relationship between your research laboratories and the clinicians. You're asking, you want a Kemri hospital. You want a Kemri hospital. So you might want to talk about it. But I know there's developments in Ghana, which is why I'm saying this. So perhaps, Gojo, you might say what your relationship is, because you have been a little bit isolated from the clinical practice.
Okay, part of the Noguchi story really was that in Ghana, the University of Ghana Medical School, my senior, I think he just stepped out, was started in 1962. Not a small joke. From the little that, from my earlier life as a young clinician and a young medical officer, 18 months after my house job, I was running the Boku District Hospital of about 250 beds. Your training in medical school doesn't give you any of these things. And to try to do that when your water system is off and you know power and things, please.
Okay. Do you want to comment on that, John? I mean, do you think it's important you have a Kemri hospital?
Well, that was just a wish. Of course, we actually collaborate with a lot of hospitals. But of course, for example, I don't know whether you know, some of the hospitals in Kenya now have been devolved into counties. It is both a challenge and also an advantage. So it was just a wish that if it would be possible, and you can actually even have just a well-run clinic. It doesn't have to be a big, yeah, thank you.
What's happening in your, where you're going to have a clinical link?
I used to be really, I was always based inside an hospital. But where we are living, there are many new hospitals and the other one. So we have already some MOU, yeah, and it's also under the Ministry of Higher Education and the Ministry of Health. So we have already the link. And we have planned also to have a DHS site, which will be linked to the institute.
Thank you very much. I think it was nice to chime in. I think for the issue of the hospital and the research institution, I have had the bad side in Kenya of having to set up 3 of similar, and I think, and even building up hospitals that are linked to government and research. And I think the main thing is that you need to do it as a partnership rather than trying to run a facility, or else it is quite a failure. I think we rather look at what are the opportunities we have in the health research in Africa and what this we have, I think, because I think a number of times we tend to ask other people to help us do our job, but I think it is high time the African researcher takes the bull by the horns. It is not somebody's job. It is our job to market science, and it is our job to position science and research where it is and help other people understand it, because it is a different ball game. And I think what I say that for us, we are in at the age where things are on our side. Those who are, the West did research when the technology was very rudimentary. We have technology to our advantage. Access to information is at a touch of a button, and I can access any information I need. How do we take that and use it cheaply and ensure that we can leapfrog our advances in health research in the region? And I think this is something that we need to look at. How do we take advantage of this? How do we utilize this and look at the partnership? And distances nowadays, I don't need even to have met somebody. We can work together without even meeting physically. And all this is purely because of ease of communication. And I think these are some of the things that we've not utilized to penetrate the remote we consider remote can be fairly close. And I think these are some of the things that as researchers in the region, we need to do this. And basically, there are networks of centers of excellence that you can work with. I know I have had the privilege of working with almost 18, 20 countries within sub-Saharan region and working with researchers in those areas, and you realize how that can work very well and how mentoring can happen across the region with less stress. And the same thing, we are in a genomic area where things have fairly been characterized, and we can use this to characterize our population. Understand that it's just much faster, much better. And I think we just need to be a bit more proactive and get this, take advantage of this low-hanging technology that we have now. And I'm not worried. I tell Kenyans a number of times that we have too much human resource in Kenya. They don't need to sit in Nairobi, they don't need to sit in Kenya. Currently, I can utilize the Kenyan sitting in Denmark, sitting in the US to run programs in Kenya. And I think this is one thing that we have not harnessed properly. We started a PhD, a postdoc program 4 years ago within partnership between Cameroon. And what we did, brought all the Kenyans that were in Harvard, were in Scotland, and then they spent time here to mentor the young ones and also do work for 2 years. After 4 years, 3 of them remained back home. And they said, now we are not going back. We are now going to run research agenda here, join the local institution and move on. And within those 3 years, they were able to attract grants. And I think that's what we have not taken advantage much more. How do you harness the diaspora scientific community that we have? These are the new ways that we need to possibly think and possibly use that. To me, the perfect example in Africa, the double epidemic is a minefield that possibly we need to mine much more. This you cannot study in Japan. This you cannot study in Europe. It is only happening in Africa. It is our time to lead the world by telling people how to deal with this double epidemic. We have what it takes. Take advantage of all the technology that we have and possibly see how this moves on. And we know that we can develop all these networks, and possibly there are several agencies interested in driving this and working on this. How do we leverage on this? How do we harness them? And how do we sit on the driving seat? That's what we have never known how to do well. They have the money, they have the technology. We can sit on the driving seat because we are on the ground. And I think this is what we have not articulated well at an institutional level and at an individual level. And I think these are the things that the mindset that we need to start working on, possibly trying to push through and make sure we get this. We have a very wide population, not characterized. We need to start looking, how do we characterize it? How do we take advantage of it and move the things forward and it is a very receptive group. With GIS, we can literally map any community we need in this region, and we can do it across countries. We don't even need to, borders are not anymore restricting us in science. And I think we need to start translating this in what we can take advantage of. And no country should strive to have all the expertise and all the infrastructure. If it is available in South Africa, why should I replicate it in Kenya? I can use it there. The component that doesn't exist in South Africa, have it in Kenya. And we need to start sharing more. Then we'll bring the government on board to appreciate that we need to work more across the borders. And currently, we have training programs between Kenya and Ghana, Nigeria, and we are trying to see that this is what is going to change and make people start networking much earlier, start seeing themselves not as a country, but much more as a global group that possibly needs to work. And I think this is what we need to possibly start doing much more and get ourselves on the driving seat and possibly help the governments to champion what we want. And I think it is us to start pitching much more what we need to our governments, and so that they can come to the table. And I think it is basically, it is a family, and the family has a budget. Whoever speaks louder gets the biggest share. And I think we need to get out of the closet of the science of the lab and possibly be able to articulate this. It requires training, and I think this is something that we need to do much more. And I think these are some of the soft skills that I think we need to start tapping in and bringing on board much more. And I think the future of Africa lies on one thing in the health sector: the schools of public health or global health and the business schools. We have to bring the business schools into health. We've tried that in Nairobi, and it is working well. We have gotten a private university with the business school, and we have started health management sciences. And we're basically trying to use this to change the health sector in Kenya within 10 years, and we hope this is going to, and I think we are now learning that we have never positioned health as a business. We have just seen it as a service that consumes money, but it is an investment. A sick man is not useful to the economy, and that's what we want to make sure. This is the business we want to sell to the government. And I think these are some of the things that we need to start doing research and driving these interlinked with all other things that we do. Thank you.
Presentation. Thank you very much. And I speak for the young researchers. My name is Bright Edu from Noguchi Memorial Institute for Medical Research, Ghana. We had a session and came up with our challenges and also proposed some solutions. And from all the speakers, they've already touched on most of the things that we came up with. And it's clear that the challenges that we face now, they have also faced some of them, if not all. But they've come this far, so there's a lot of hope for us as well. And I'll just first of all touch on the challenges. This is not to say that the picture is all, dark and gloomy, but these are the challenges that we identified as relevant to us as young scientists coming up. So we identified training opportunities to be one of the major problems or challenges as for young scientists in Africa. We need more, there are not enough postdoctoral fellowships. Sometimes people train outside of the country, and when they get back, they are stuck, or they don't find a place to easily fit in. And the temptation is always very easy to return and just stay where you can easily get a program to train and develop your career. So this is important. And I should also say that sometimes even the local government may spend money to train PhDs, but that's where it ends. When they return after their training, they don't get the career path very clear to continue. And so there are a few, like Noguchi has started, and I hear a few other institutions in Africa, but these are so few that the competition is simply just too fierce. And if there are more, it will help. Then lack of well-structured and formal mentorship programs, because we have mentors, in quotes, people we all look up to as young scientists. They may be far, they may be near, but it can only help so much. It would be nicer and more useful if we had a very formal and structured program of mentorship to help young scientists develop their careers properly. Then funding opportunities. It's wonderful that there are a lot of foreign company agencies that support African scientists, but we are also looking to have support from our own local governments, because if our local government begin to support research that are relevant to the population, they would be more keen to use the results that come out of those research. And we think this is very relevant. Instruments and capacity also limits the extent to which young researchers can develop their career, because you may have trained in an institution where you had a lot of high-end instruments and very sophisticated machinery, but you return home and you don't have a confocal microscope, for instance. And this is a very expensive instrument, but without it, all your training is really, you can have very little use for that. So this is another area that is a big challenge. And then collaboration between government and other stakeholders. There has to be, we identify this to be another very important challenge that we deal with. There should be more of such. So we came up with a few solutions as well. We feel that there should be more postdoctoral fellowship programs, basically. And other trainings that are not just postdoc, because you may be doing a postdoc, but you may need to pick up a little bit more skills in basic statistics, or some bioinformatics, or some other areas, data management. So these should be engrafted. Grantsmanship. After your postdoc, you want to have to generate more funding to continue your career. And so all these should be incorporated in the training programs for young scientists. Yes, I've touched on funding. Then formal and well-structured mentorship programs. And then establishing networking. So we think that among young scientists in places like this, I have met a few of young scientists from other places. This is the beginning, but there should be more platforms to allow us to network and to, develop our careers. Then there should be a healthy research environment, strong institutional support, structures in place to help young ones know, okay, this is where you enter, this is how you progress through the path, and this is where you are likely to end up. Then finally, this is an advice that came to all of us from ourselves, but we should also learn to take advantage of online training programs that are freely available or at very small fees, so that we can develop our careers or our skills, even in the absence of well-structured programs like postdocs and other things. That is just something small we can do on our own, but we definitely need these programs to support our career. Thank you.
Thank you very much, Dr. I think that was an excellent summary, really, of the situation, brings a lot of things together. So we're coming to the end of our time. I think I don't want to be guilty of, you lost your coffee because of me, if you lose your lunch as well. So I think probably we should go on to give you time to, but I think you're all going to be around. There'll be a chance to, if you have a question, come and try and catch our speakers at lunchtime. So perhaps I just a final word from me, really, because I've been, as you know, for a long time. I mean, originally, it was really training technicians at the beginning, because there weren't the people who knew that. Then we sort of moved on to PhDs, and that was the flavor at that time. I think now it's moved on to the postdocs, and I think that's a really important area. And if we have meetings like this around Africa, very often that's the first thing that people come up with, the postdoc positions. But I think we're moving on from that as well. And I think, the whole thing of this capacity development is really being flexible and not just sort of stuck as the way we did things 5 or 10 years ago, and thinking about the new technologies. And I think it was a very important point that you brought out of the accessibility now of new knowledge through different ways and things. So I hope, that if 5 years' time this same sort of meeting happens, then there will be some new ideas, new ways of, and new challenges in strengthening African research, but new ways of doing that. So thanks very much to all our speakers, and I think we have a closing session before you get to your lunch.
Thank you very much, Professor Greenwood. Thank you very much for your wonderful role as a moderator, and I appreciate wonderful presentations from all the panelists. Now we are moving to the closing session.